Community icons attended the 2026 Future Health Leaders Symposium, hosted by the Academic Medicine Consortium of Arizona. This statewide initiative introduces students and families to careers in medicine through mentorship, engagement, and real-world insight.
When we grow up, we don't know what we want to do. And we want to do what TikTok tells us, we want to do what Facebook tells us. We're prey to the media. Everybody wants to be the next Mr. Beast. Nobody aspires to be the one that can create a new surgical technique or develop a new medication or help their community to become healthier. So instead of being sound bites, we want to inspire our youth to become healthcare leaders, because when you deliver health, you're going to be, by forces of the situation, a leader in improving people's health. So we want to inspire our young people to aspire to these careers, all the way from assistants to surgeons, from radiation techs to cyber knife surgeons, and all the way in between. Of course, our masters in public health and managing the resources. And if we don't inspire them, who will? The biggest barrier that I see in healthcare today is unfortunately misinformation, because it's so cheap to spread it and it's very difficult to erase it. And people no longer know what to trust or what to believe. So how do I come the authoritative teacher of medicine if people are not going to believe my words? So we intend to practice by example. We practice with proof of what we do and improve people's lives with effects, not just words. Not to sell a new product, not just to sell a new chemical, but actually show them in a year or 2 or 10 how their lives improves, or how we save their loved ones' lives, or how we can make products more affordable for those who really need it. Seeing the tremendous amount of varied backgrounds joining us is tremendously encouraging. Right now we have at our clinic a wonderful young lady, as Goldilocks as she can look, daughter of a Mexican lady engineer, civil engineer, and Anglo-Saxon, I guess, father who is an oil engineer. And she is fluent in Dominican Spanish, in Mexican Spanish, as well as English, and she's got 2 engineering degrees under her belt. Seeing those kind of people want to become doctors inspire me, and I think should inspire everybody. Today's energy is the energy that will prevail. We will not back down. We will not let fatigue get the best of us. We will be here in 2026, 2028, in 2040, we will still be here. We are people, and people will still live and need health care, and we need to help each other. We don't care where you come from. We don't care what you believe in. We don't mind who you love. We just mind to give you your best health, so you can become the best version for the human race. The Arizona Latin American Medical Association was founded over 30 years ago to inspire young people to join the rank and file of becoming physicians. It was founded by Adolfo Echeveste, who was the general manager, I think, of Maricopa County Health Centers in those days, that realized after managing so many hundreds of doctors, there was no representation of any Hispanics, and yet the population was absolutely despaired to that. So thanks to him, I think we've inspired and we've donated money and scholarships to hundreds, if not more, students throughout the years to pursue their careers and achieve them with a little dignity, because doing medical school is hard. You can't have a full-time job. You can't have a part-time job. So we in ALMA will donate money so the ride can be a little bit smoother. Going to medical school is a privilege, but it's not a privilege that comes because somebody is wealthy or lucky. It's a privilege because you're smart enough to make it through this career, and we want to be one of those respites where we can get a little money in your pockets to keep going, to pay for the food, to pay for the electricity or the dorm or the computers nowadays or the handheld ultrasound, because it's becoming more technical and it's becoming more difficult. So that's what ALMA does, and we're still going to be here 30 years from now.
It is very rewarding to teach the next generation of physicians. It's inspiring to see these younger, bright minds complete the residency training and join the medical community and become the physicians that are essentially going to be taking care of us as we age. Always believe in yourself. Never think that you're not going to be that kind of, person or profession that you want to be. Always believe in yourself. Mentorship, it's about inspiring people. That feeling that this person, that your mentee would have when it comes to, this is the person I really want to be. I want to be just like this particular person, just to make impact and change society. An event like this will inspire people to consider a healthcare, profession earlier in their life. So they really don't waste time just, thinking about something else, especially if they want to service the community. An event like this would probably help diminish the shortage of, at least primary care physicians that we have in the country. If I could speak to myself at a younger age, I would probably self-reassure myself. You could totally do this. This is something that would probably be very, very rewarding to be helping people in the community as a medical professional. Most important quality in a physician, I think, it's commitment and ownership of your patients. Responsibility, strong work ethics, a lot of these things come into play to become a good medical professional. The growth of the city of Phoenix is incredible over the last 2 to 3 decades. And as a result, there has been such a shortage of medical professionals. Arizona physicians do matter because we do need physicians to stay here in Arizona to take care of our own people, given the staggering growth of the city.
Students face a lot of barriers, no doubt. But having support systems around to help overcome those barriers is very, very important. What we found is that knowing that guiding people on what can be done, I think as time goes on, they'll be more interested in making applications to schools, which schools they should apply to. Getting scholarships for funding is very important too. So a lot of times they worry about, am I going to be able to get scholarships? Fortunately, there are a lot of resources all along the way. And what students should do is to focus on merit, on getting good grades so that they have strong applications for when they go to school. There are groups such as the Arizona Latin Medical Association that will help to support them financially through schools. And there are definitely support that come from the institutions themselves to help them get through. So these should not be barriers to applying at all. Just know that all along the way, there's support for people, and symposia like this help them to know that there are many groups that have a lot of interest in them succeeding. This symposium strengthens Arizona's healthcare future by giving students a chance to get together to see that they have other people with like interests, as well as giving them encouragement and guidance on how they should pursue the medical careers. It's essential for us to have strong education and medical pathways. Certainly as a physician, as a doctor, it's very important that we have more doctors to take care of all the patients that are going to be here. But then also with education, and I'll say biomedical education, to have other people in the career, because we can't have just doctors by themselves. We have to have nurses, we have to have engineers to create the therapies that we're using. And we also have to have strong people to go out into the communities to let people know how to navigate the healthcare system. So that all comes with education, and we can't rely on other people to do this. We have to be able to do this ourselves, and we need the students to come from our communities so that we can have our doctors and our healthcare system for us. The future of healthcare in Arizona is bright. It's very bright. Me standing here in this building now means that the medical education services in Arizona are expanding, and they are open to take care of all Arizonans, right? So Arizonans from all communities should apply and know about these institutions as they exist. The University of Arizona, Arizona State University, Creighton College is here, College of Medicine. We have Midwestern College of Medicine. So they're all here now, and these are all opportunities for students, for young people who are interested in medical careers to take advantage of. So things are looking much better for Arizona than they have ever looked.